Hi, you guys. This is Emily Smith. We're going to be talking about assistive technology, stigma, and education for ATHS 697. So let's get started. These will be the topics that we're going to be discussing. Interconnections between human and technological factors, AT in different societal, generational, and cultural contexts, leadership and group dynamics, product design, regulatory policies, and professional ethics. So the first topic is program learning outcome number 1, which is interconnections between human and technological factors. So one of the benefits of AT is participation. Participation can include completing assignments, grades, and engaging in the class. AT can increase the GPA of a student. It is also important to note that in one study, they found that many students showed significantly higher rates of repeating the course until a satisfactory grade was obtained with the use of AT. Another benefit of AT is social and engagement. Social reasons are a positive aspect for students to use AT. There are many devices that encourage students to engage with their peers. There are some examples such as picture exchange boards, iPads, cue cards, computers, and even the internet. The internet and computers are a way for children and individuals to communicate and to form social relationships with their peers. Another benefit of AT for students is independence. Individuals are able to accomplish tasks independently without being reliant on their family, their friends, classmates, and employees with the implementation of AT. AT provides students the ability to gain independence that they previously didn't have. AT allows individuals to learn strategies for coping with their difficulties. Since they are perceived as independent in the eyes of their peers, they can also be perceived as normal, which is a benefit for students with disabilities. Lastly, another benefit of AT is confidence and attitude. Students can feel more confident academically. Additionally, they feel more confident with a positive attitude around their peers. Unfortunately, assistive technology still has stigma attached to it. Stigma can lead to an individual feeling fear or shame around their disability. This can result in anxiety and depression. Stigma can have an impact on the student in their school setting, such as their grades or how they interact with their peers. Stigma can also affect relationships outside of school and the feelings of oneself or their confidence. So the impact of stigma on assistive technology, the fear of developing stigma among peers can be a reason for an individual to abandon their device. Further, individuals are perceived amongst their peers, such as if a device is to make them look different, would be for a reason for abandonment. Individuals might change or abandon a device while looking for something that fits them better socially. There tends to also be a lack of training amongst teachers and users. So if a teacher is not fully implementing a device or is not fully trained on a device, this can also be a reason for AT stigma. All right, so let's move on to program learning outcome number 2, which is AT in social, generational, cultural contexts. So cultural. Understanding cultural backgrounds is essential to treating individuals with disabilities. Understanding varying cultural views of disability and its relationship to diagnosis and treatment may be crucial to AT interventions for children with disabilities. Many different cultural backgrounds have varying views of AT interventions. For an example, many Asian, African, and Latin cultures are raised to be reliant on one another. So this could lessen AT recommendations as they are able to rely on family members or the community instead of AT. Generational. Older generations can view a disability possibly as more of a burden. Views of oneself could possibly be less than for the children. Older adults also lack knowledge of understanding in regards to the AT that exists. Because of this, their children or future generations are also unaware of the AT that can help them. Further, this can create stigma in regards to them implementing or not wanting to implement devices. Other generations can have a perceived idea of what AT is, although it might not be correct. This can be passed down between generations, creating an incorrect idea of assistive technology. Social acceptability in social context. Social acceptability of AT is one of the most essential elements that impact whether a device will be continue to be used or not, especially in an educational setting. Social acceptability is typically closely related to stigma that can be associated with a device. AT can cause rifts between peers within the educational setting. Students who are attempting to make friends but don't meet social norms due to their AT have difficulty in doing so. If an assistive device marks them as other, it could create social barriers to access, even though it should be doing the opposite of that. Okay, so let's move on to program learning outcome 5, which is leadership and group dynamics. So groups can be impacted by assistive technology. So in some cases, AT can negatively affect group dynamics. Students without disabilities have noted feeling a range of emotions. Some include pity, judgment, sympathy for the user, inspired to do better, fear of asking the wrong questions, or ashamed. Because of these feelings, the AT user can be excluded or feel as though they and their devices are stigmatized. Many devices clearly label the user as someone with a disability, such as a wheelchair. Therefore, many times other peers will form an inaccurate idea of the user's capability or identity based on the sole fact that they are an AT user. Implications of AT use in the classroom. So teachers have the ability to influence the attitudes of the students in the classroom. If teachers project a negative opinion based on a device, then many times the other students will follow suit. So teachers are considered the leader of the classroom. If teachers have negative views towards their students with disabilities and the users of AT based on myths that these individuals are taking away from their typical peers, then the ability to accept the student can be minimized. It also shows their typical peers that it's okay to treat their AT users and students with disabilities as less than. The extent to which a group of people might stigmatize a student with a disability who uses an AT device might be due to the teacher and the environment that the teacher produces. Okay, we're going to move on to program learning outcome 3, which is product design. Assistive technology aesthetics, or the look of the device, can definitely be related, or stigma can definitely be related to these looks and the aesthetics. Stigma can be created when a device is looked at as different by others, creating shame for the user. Aesthetics of a device is one of the things that can create stigma, as it may indicate dependency on the user. So for an example, a wheelchair. It can make the user look passive, helpless, and dependent solely based on the AT. It is essential for universal design elements to be implemented in AT design. Universal design has the ability to decrease stigma since students without disabilities also use those same devices. For an example, iPhones and iPads are used inside and outside of the classroom for both students with and without disabilities. So this can decrease stigma for students that are using it as an AT device. AT function tends to be something that can create stigma as well. It tends to be a step behind typical technology. So for an example, cell phones have many different features and functions to them, but a Braille note, for an example, which is an AT device, is just catching up. If a device breaks while the user is using it, it can lead to the feelings of embarrassment, nervousness, and anxiousness. The function of the device needs to be more important than the stigma or embarrassment that could be attached to it, or else the individual or student will not use it. Okay, moving on to Program Learning Outcome 8, which are regulatory policies. So Section 504 of the Rehabilitation Act of 1973 states that no otherwise qualified individual with a disability shall solely, based on the reason of his or her disability, be excluded from the participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. Because of this, it protects against discrimination for individuals with disabilities. It also provides equal access through the Section 504 accommodation plan and provides federally funded assistive technology. The Individuals with Disabilities Education Act requires free, appropriate public education that emphasizes special education and related services designed to meet their unique needs. It also requires an individual education program, an IEP. So this describes each student's specific needs and allows for AT to be implemented. Americans with Disabilities Act, the ADA, is a federal law that prohibits discrimination based on disability. So colleges are required to make reasonable accommodations and procedures in order to provide fair treatment to students with a disability. So for an example, if a professor has a rule that nobody can record in their courses, but if a student has an accommodation for a recorder, then the college might have to waive that ban for the student. This lowers stigmatization so that the student does not feel singled out. The Assistive Technology Act of 1998 was intended to promote awareness of and access to AT devices and services. With increased education comes lower stigma rates. The AT Act covers all individuals with disabilities in all environments. So this includes all ages, such as early intervention, K through 12, and even the aging population. So with the passing of regulatory policies in legislature, like all of these listed above, students with disabilities who require AT have the government to back them when they feel stigmatized and discriminated against, which is definitely a positive for lowering stigma rates. Okay, so let's moving on to last but definitely not least, the Program Learning Outcome number 7, Professional Ethics. So RESNA, or Rehabilitation Engineering and Assistive Technology Society of North America, but it's definitely better known as RESNA, is an organization that promotes the health and well-being of those with disabilities by increasing technology. RESNA sets forth standards of practice and bylaws in which they promote professional ethical standards for practice among individuals who provide assistive technology. RESNA finds it essential that anyone who is certified AT professional shall abide by their codes of ethics. So one of their important codes of ethics is to hold paramount the welfare of persons served professionally. So they must hold everybody at a high standard. Another professional ethics is HIPAA, the Health Insurance Portability and Accountability Act of 1996. Requires all healthcare providers, including AT professionals, to keep any personally identifiable information confidential. HIPAA standards that AT professionals must follow require them to protect their privacy rights. So if an individual feels as though their privacy has been violated, such as somebody mentioning their disability or their name, they can file a complaint through the Office of Civil Rights. So this allows for people to feel comfortable in mentioning their disability to AT professionals without feeling stigmatized. And here are the references. And that is it. Thanks, you guys.